been what we've been talking about extensively. Will there be stricter restrictions to help stem the tide of this third wave of COVID-19 infections? Well, some health experts have called for harsher restrictions, while organized business wants the president to keep the economy open. We discuss now the possible scenarios for the country, and joining us for this discussion, Martin Kingston. You will know him from B4SA, well, Business for South Africa, if you want to simplify it. He's the chair there. Professor Jeffrey Mphahlele, he is a member of the Ministerial Advisory Committee and the Vice President of the SAMRC. And we also have Maurice Smithers, Southern African Alcohol Policy Alliance Director. Dr. Angelique Coetzee, you'll know her from the South African Medical Association. She's chairperson there. Dr. Samantha Fee, the Gauteng GP Alliance member. And last but not least, Pete Leroux, CEO of the organization Sakeliga. And they are all joining me for this all-important discussion. So, as you will know, for this segment of the show, we ask one question to everyone, and I'd like you to ponder this question, and I'm going to start with you, Mr. Kingston. To lock down or not lock down? And give me your reasons.
Good afternoon, Collie, to you and your viewers. We absolutely think that there should be increased lockdown measures. There are 4 points that I would like to make. The first is that we need to stop gatherings wherever that's practical or possible. There need to be sanctions that are imposed for people who actually break regulations that are already in place, including those that pertain to non-pharmaceutical interventions. We're seeing marches that shouldn't be permitted, for example. We think that curfew hours should be increased, and we think that we need to do everything that we can to keep pressure off the hospitals, particularly as we're in the third wave. If we don't do that, then the reality is that whatever rebound we've been seeing in the context of the economy after last year's lockdowns will not be possible. So we need to intervene now, and we need to intervene comprehensively.
Dr. Coetzee, let me come to you. You sit in the Ministerial Advisory Committee. To lock down or not to lock down?
Good afternoon, and thank you for asking our opinion. I was just reminded by Martin that it's never too late to lock down. But where we are sitting from a medical perspective, it is, for us, it's really too late. All that we would like to ask is for each and everyone to stay at home. You have to stay at home. The gatherings, it's out. There should be no gatherings. The curfew should be stricter. We have asked this before. We have also asked for the schools to be closed. I need to remind you that at this stage, because of the severe amount of people or patients that we are seeing on a daily basis, the frustrations that the doctors and the nurses are experiencing on a daily basis, leading indirectly to an emotional switch off of these doctors and nurses. And it is as if you are just on autopilot. You distance yourself and you carry on. But what we think is the most important thing, that except for people must stay at home, except for that, is there need to be an urgent look at how we can sustain the hospitals, getting everyone that's got good medical knowledge. We cannot afford to get clowns in. We need to get people in that can do the work to help at whether it's public sector or private sector. Then on the second thing, primary healthcare has been severely neglected. We can, in this wave, treat about 80% of patients at home, but we do not have home oxygen. So whoever of government is listening there, we need home oxygen. Otherwise, you're going to see people dying like flies. And I'm not exaggerated here. I know what we are seeing. Vaccination, I need to make sure that people understand it's not a silver bullet. It's going to help us, but it is going to help us especially with the fourth wave. for now, if you've been vaccinated 30 days after your vaccination, you're still not safe. We need to get that message out there. So yes, people need to stay home. Thanks.
Dr. Mpahlele, your thoughts?
Yeah, no, thank you very much, Dolly. So I must say that I agree with my colleagues on the panel that we need stricter measures. But I have to say that at this point in time, almost 1.5 years with the experience of dealing with COVID-19, hard lockdown is just aspirational goal. So I don't see that happening. I see, the president going to try and balance what he does all the time between lives and livelihood. But clearly, we need, stricter measures. We must not forget that this epidemic is driven by one province at the moment, which is Gauteng province. So if we can focus on Gauteng province, like we have done previously with the first and the second waves, because you will remember that for the first and second waves, they were affecting mainly the coastal regions, Western Cape and Eastern Cape, and there was a stage where beaches had to be closed in some areas, and that was just specific, for those provinces. So we need something specific for Gauteng province as a temporary measure to hold the new cases, because it will be unfair to treat all the provinces, and paint them with the same brush. But that said, obviously we will have to need national, measures which can really restrict movement of people in all the provinces. And obviously, some of these things have been mentioned by my colleagues. Low-hanging fruits include, banning all the gatherings except maybe funerals. So we will see how it's going to happen. We can only make assumptions. I don't envy the president tonight. And in fact, when I'm reflecting about this week, that we started the week with very good news, that South Africa has been given, the status to start messenger RNA technology. And now we have got bad news because we've just learned in the last 24 hours that the Delta variant is gaining grounds in the country, and we can also see that this third wave is driven mainly by the metropolitan province, Gauteng province, which is the economic hub of the country, and this really is placing South Africa in a conundrum in a way.
All right, Piet Leroux.
We've had more than almost a year and a half now of experience with this disease, and it's rocked the world in unprecedented ways. The interventions we've had so far, it's not clear that they have been very helpful. And in fact, as different regions in the world start relaxing many of their restrictions, including mask mandates, restrictions on gatherings, etc., we're not seeing in the data clear evidence that these interventions, that we know which ones work and which ones don't. And in fact, it seems like many of them don't, even if for some reason we think they do. So what I'd like to suggest is a little bit with respect on the other side of what some of our previous speakers have suggested, which is that instead of zooming in, I think we should perhaps zoom out now. And we've tried a centralized approach to managing this health risk. And it's a severe risk. Many of us have lost family members or friends and so on. So the risk of death and severe illness regarding this have come close to home for virtually everyone by now.
Yeah.
And so I would like to suggest that we should try a more decentralized approach, which was, and I don't expect this to happen tonight if the president speaks, but I think it would have been prudent for him. And I think it would be more advisable at this stage to say that, look, close to 1 million people have now had the disease, they've recovered. They are, for all practical purposes, much more safe than others right now. Then, yet again, other people, we've seen unemployment numbers shoot up to unprecedented levels. People don't have money to put food on the table. We have to realize that the risks across the economy, the risks for people are very different depending on your wealth profile, your age profile. And so I think it's important to allow for a more decentralized approach and for the President to speak with authority, explaining the severity of the situation, but not introduce strict lockdown measures, one size fits all. I don't think those help, and I think insofar as they help, they are overshadowed by the social instability we're breeding, which we cannot afford. People are going hungry.
Sure. Dr. Samantha Fee, your thoughts?
Oli, I agree entirely with Martin Kingston's 4-point summary, and I also completely understand where Dr. Coetzee is coming from. I think what we're finding on the coalface as healthcare workers is, sadly, our society are not showing to be very good at self-regulation. So this balancing act between keeping things open and keeping infections numbers down, certainly at the moment what we're witnessing is not working at all. With regard to the very complicated concept of a hard lockdown and the economics that I can't speak to, I think what the healthcare workers would enormously appreciate, and in fact has become critical, is some kind of a chance to catch breath, what other parts of the world have called a circuit breaker. I think we perhaps would have appreciated that a couple of weeks ago, as we could see this coming as the numbers in our practices started to grow. Mm-hmm. And we now sit in an unprecedented situation where we are all absolutely at capacity. And it's the third time we've done this. So burnout doesn't describe what I'm seeing in my colleagues. You know, the medicine, in fact, is not that interesting anymore. We've all become fairly proficient at managing COVID cases in varying severities at home. But what we're battling with is the numbers and just purely being completely overwhelmed. So if there is some way that we can draw breath, try and empty some beds, try and free up oxygen availability, I think that would be appreciated enormously by all frontline healthcare workers at the moment.
Maurice Smithers, you get to have the last word before we take a short breather. You are with the Southern African Alcohol Policy Alliance Director. Stricter measures or not? I think you've muted. Let's try and unmute. Maurice, you are muted.
Yes, unmuted. Thank you. Thank you. So, yeah, as a social justice organization which is concerned primarily with alcohol harm, obviously our focus is on how to prevent alcohol from sabotaging our efforts to fight the pandemic. And we see 4 objectives with doing that. The one is to reduce the spread of the virus. The other is to limit the pressure on hospital beds. Also to limit the economic fallout and to mitigate the unintended consequences of whatever restrictions are imposed, for example, the illicit trade. And we think that the best way of doing that is to target on-consumption outlets, not off-consumption outlets, as was done on the 15th of June. Because on-consumption outlets, they are the ones that help to spread the virus. They contribute much more to trauma cases from interpersonal violence and road traffic incidents. And in both instances, they put avoidable pressure on hospital beds. Mm-hmm. So therefore, what we suggest is we do what happened just after the first complete lockdown was lifted on the 1st of June in 2020. Mm-hmm. That is that you ban all on-consumption alcohol altogether. But you can allow all outlets to sell off consumption. In other words, if you're a restaurant or a bar, or whatever, you can sell takeaways, but you can't have people coming in and sitting down and drinking, because that's what spreads the virus. That's what gets people in social drinking. And obviously you must back that up with effective but fair and lawful enforcement. The other thing is to stop all social gatherings altogether and get people to stay at home and to extend the curfew. And these are the steps that have been adopted at crisis times in most other countries in the world, where they haven't had bans like we've had. And finally, if that doesn't work, then only you go for a complete ban on alcohol. But we avoid that if at all possible, mainly to avoid the economic fallout, or to limit the economic fallout, should I rather say, and to limit the rise in the sale of illicit alcohol.
Right. Well, those are the thoughts of my panelists on this one question about whether to lock down or not lock down. But we know that we already are on lockdown, but it's about the stricter measures and how they're going to impact both on the economy and perhaps help lessen the burden on the health side. We continue watching the uncensored debate, and I have a panel of experts standing on all ends of this debate. It's about how strict can the president go tonight when he does lock down the country, if indeed that is what he is going to announce. I want to start with you, Dr. Mphahlele, and I want to quote a health professional, a fellow health professional, who says, and it is Professor Francois Venter, he's with Wits University, he says that Gauteng will look like India in a week or two, and this is in reference to the hospital's abilities to handle a tidal wave of patients. Do you concur with him?
So partly yes, partly no. I think is a good question for Dr. Coetzee. But all I can say is that the hospitals are overstretched as we speak, and the fatigue of the healthcare workers is not something that we should undermine, because they've been working flat out since last year, and most of them actually did not even have a decent break in between. So yes, I think it is important to realize that Gauteng has got escalating cases, and we know that both the private and the public hospitals have come out to say we are on the almost full capacity in terms of bed capacity, and some of the hospitals are already at full capacity. They can't. You have to wait for a number of days before you can get a bed. So we don't want this situation where we just continue not to help the situation as members of the public, and hope that the hospitals will keep on taking pressure. So yes, partly I agree with him that if we don't play our part as members of the public, we will eventually overburden the hospitals.
Mr. Kingston, can I come to you next? The sectors of the economy that can handle much tighter restrictions, and you will define what much tighter means, which are those?
Well, I think we've seen already that with the exception of the level 5 lockdown that we experienced last year, and nobody is proposing that should happen right now, that there were many sectors of the economy that we were able to open up, provided that they conducted themselves in a responsible manner. I mentioned before the need for enforcement. Maurice also said it. We need to enforce compliance with the law, both within the workplace, by the way, as well as outside. One of the ways of doing that is to ensure that gatherings, as we've all said, is prohibited. None of that prevents the economy from moving forwards. Obviously, there are certain sectors like the mining industry that have been an absolute powerhouse over the past 12 months, partly as a result of the commodity boom and cycle, that have been able to drive economic activity. And there are others, particularly in the leisure industry, and Maurice touched on that, for example, in the context of the restaurant hospitality sector more broadly, that have been very badly impacted. But we have to recognize that it is those very self-same sectors where we see transmission of the virus taking place most aggressively. And if we're going to restrict them, then as a country, we need to provide them with the necessary support that we were unable to do over the past 12 months to ensure that the individuals and the businesses do not find themselves either closed down or indeed liquidated or in business rescue or as individuals unemployed. That as a country, I do not believe we can sustain. The first two lockdowns in reality as a consequence of a response to the first and the second wave, as far as I am concerned, was simply a dry run for what we're likely to be experiencing now in the third and potentially a fourth wave. And as Angelique has said, we at the same time need to aggressively roll out the vaccine program, which is not going to be effective in the immediate short term, but will help us to curb transmission, or more importantly, infection and mortality, and of course the pressure on the healthcare system in future months to come.
Yeah. Let me come to you, Pete Leroux, on the issue of tightening compliance that Martin Kingston touched on earlier in the response. Trevor Manuel, the former finance minister, just said to me a few moments ago that, well, the police and the army combined were ineffective in enforcing the rules. In your view, is that going to work if indeed that comes to pass this evening, if the president does say to make sure that whatever measures are put in place, they're going to be complied with, you're going to bring on board law enforcement?
I think, unfortunately, the way the situation has been handled through the different waves and through the different stages of lockdown have left people not feeling confident that these measures have been taken prudently. And so I'm not sure that the weight of more enforcement will be significant, will be a determinant. Will be the absolute determinant. What we have seen is that more than 1 million people don't have jobs that had jobs more than a year ago. These people and the savings they had and the savings in the rest of the economy have been depleted in trying to stay afloat. So we have much greater pressure on people to try and make a living, eke out a living in these circumstances. And the more we now try and increase enforcement, increase restrictions, still the less able people are to do. And I think we're risking losing the presidency and the government losing the moral authority that they can have in this situation by underscoring the need to take extreme measures. We had a doctor earlier this week, Dr. Daniel Israel, writing a letter saying, be your own president. And if you're at risk, lock down yourself in level 5. You don't need a president to tell you that. But I think the president could do what would be advisable is to underscore the importance of the problem and the situation, as some of the other speakers on the panel today have done. But what is not advisable is to get the military and the police to be much more stringent in the lockdown. We must realize that people need to put food on the table.
All right. Dr. Coetzee, let me come to you. You're quoted in the papers today as saying that the advice, as a person who serves in the Ministerial Advisory Committee, you're being ignored. You flagged this some 4 weeks back to say lock down or tighten the measures. But now we're in the situation we're in because government did not listen. I want to perhaps put you at loggerheads with Maurice. What's your take on alcohol? He says shut down on-site consumption and allow for alcohol to be sold so that you consume it at your home. Would you support that, or do you want a complete shutdown of alcohol?
Well, yeah, let me come in and say SAMA had also, since the first regulations has been announced by the president, we kept on telling the press and the government that, please, it was not enough during that time. But, you know, I'm always say, who are we? No one wants to listen to us. So we are only the doctors treating the patients. So to come back to Morris' question, at this stage, you know, it makes no sense to have alcohol consumed at a site and not at home, because we want to get people at home. So you know, I have to agree with Morris regarding consumption at home, because that's where you want your people. We want people to be at home. We are asking for people to be at home. But again, we are focusing so much on what lockdown needs to be that we forget that there's not enough measurements in place to treat these patients. And we actually should not now sit here and wonder whether alcohol should be allowed or not, and whether we should travel or not. We need to discuss here, how are we going to treat these patients, 80% of them at home? What can we do? How are we going to get oxygen? There is not enough home oxygen. If there's not enough home oxygen, you're going to die. I cannot get oxygen. I cannot make oxygen. It is a huge problem. So yes, we need this conversation. But we are actually past that. We are now, how are we going to treat these patients? From SAMA's side, I have asked that we have an urgent webinar next week, either Thursday or Friday night, where we get a lot of the GPs who are actually working with these patients who've got COVID-19 so that we can get the message out how to treat them at home. But we can get the message out, I can treat you at home. But if I don't have oxygen, you can stop all the interprovincial travel. You can stop whatever you want. If I don't have oxygen, people are going to die. And currently, we are running out of oxygen. And it's not about a bed. Each bed needs a doctor and a nurse. It's how are we going to get nurses and doctors around that bed to treat that patient. There's enough beds in the country, I promise you. But there's not enough people. And that is where the conversation currently must be. Yes, and people must stay at home. If you can work from home, you should work from home. If you need to go for an operation and it's not an emergency, then you stay out of that hospital. If you've got a backache for 2 months, don't go and see your GP during this time. Stay at home, take a painkiller. Do not do the type of things that people are doing out there is mind-boggling. I promise you, I can just start to laugh, because if you don't laugh, you're going to cry for the stupidity that's going on. And yes, we are not known to be known as a country.
Oh, Dr. Coetzee, I think she's frozen there for the moment, and perhaps cueing us to go on a short breather, because when we come back, I want for Samantha Fee to talk to us about the treatment at home that Dr. Coetzee is talking about, but also Maurice Smithers, your response on this alcohol debate. Should we even be having such a debate at a time like this? We continue with the conversation in just a moment. If you're just joining us, you'll find us as we're about to wrap up the uncensored debate, and it's around how tighter can these restrictions be if indeed the president is going to announce such this evening. And let me pick up with you, Dr. Samantha Fee, on the back of what Dr. Coetzee said, that what the conversation should be about right now is the apparatus that need to be in place for people to be treated, because people are infected with this, particularly in a province like Gauteng, which is being overwhelmed by a variant first discovered in India, and it has decimated that country. The scenes that we saw, people being cremated outside of crematoriums in full view of the public, that is just scary. Talk to us about what you can do as health professionals on the home environment. Are doctors even able to treat patients at home?
Well, yeah, I think just to echo Dr. Coetzee's impassioned plea with regard to oxygen, yes, that is something that we all are finding in short supply, and typically at an extremely desperate point when we're treating patients at home. To find that that is not a solution that we can realize is literally a matter of life and death. To talk you very briefly through the management of a COVID patient at home, we are all following very similar protocols. The ambulatory COVID patient, as in the patient that doesn't need to be in a hospital bed at home, where within the first week of the viral illness, we help them manage their symptoms and give them advice. And then in the second week, we need to start to watch very, very closely, because this is an unpredictable virus, and we are finding it very hard to predict who's going to recover well within a 7 to 10 day period and who might be unlucky enough to start to develop some of the now very well-known and frightening complications. What we're finding is useful before oxygen is that little device on the end of the finger called a pulse oximeter. But what that does is help us predict what the oxygen levels and requirements for that particular patient are. And if they start to drop, we know and our patients know that the next step is going to be increasing that patient's oxygen supply. We have two ways of doing that: oxygen tanks, which are really useful, particularly if the lights go out. But once they're empty, and we're battling to get those replaced. And then a device called an oxygen concentrator, which draws oxygen out of room air and provides it at a concentrated level. And these devices are incredibly useful in keeping moderate and almost severe patients at home and not requiring transport to a hospital and the use of a hospital bed.
Yeah.
But we've got a Gauteng GP collaboration WhatsApp group, and if I tell you, every time I pick up my phone, there are between 3 and 10 GPs asking if anyone knows where they can get hold of an oxygen concentrator urgently, which means that GP is watching a patient decompensate in front of them and has already tried to get a bed or an ambulance, and that's been a negative. So yes, oxygen is an enormous issue. I think for me, and I think for all of my colleagues, oxygen supply and the vaccine rollout are the two things that we are desperately waiting to see some solutions offered.
Yeah.
And if, just as my closing point, I could just speak to the discussion around lockdowns and social gatherings and work. Certainly in my practice, and I think I am a fairly typical practice in Gauteng at the moment, the majority of rampant infections have occurred in social gatherings. We have found that businesses, schools, even restaurants and most other commercial enterprises have outdone themselves in trying to follow the rules and provide every single thing they can in order to prevent infection on their premises. But it is the social gatherings, funerals, weddings, churches, and then just Sunday lunch with the family, where we are seeing one infection become 10 in 72 hours.
Sure. Maurice Smithers, you hearing all of this detail that is coming through about the situation at hand. Should we even be discussing whether or not to shut down alcohol?
Thanks, colleague. You know, just by the way, to put something in perspective, I was looking at the numbers for India the other day, and in fact, a couple of days ago, yesterday, I think I was looking that Indonesia's got a sudden increase in cases. One of the things we need to understand is that South Africa is actually in a worse situation than India already and Indonesia, because if you look at the rate of infection per million people and the rate of deaths per million people, we are higher than India. We are higher than Indonesia, because Indonesia has a population 5 times the size of ours, and of course India has a population of 1.4 billion. So I just wanted to put that in perspective to show how critical our situation actually is. Look, the alcohol issue, we have to talk about it, because you have to decide how to handle the situation in the best way possible. And as I said, the main thing is to curb the spreading of the virus, and everybody agrees social gatherings is doing that, and also to try and keep the hospital beds as free as possible. And so banning off consumption is the best. On consumption is the best way of doing that, and should have been done on the 15th of June or before. And we agree, of course, with Dr. Coetzee and the other medical experts that the focus has to be on how people can be treated at hospital and home. But so to be clear, from our perspective, restricting alcohol access, banning social gatherings, extending the curfew, are all steps needed to create the optimum conditions for addressing the critical medical issues that have been raised. How we deal with the alcohol is really the question. The only reason why we are not supporting a complete ban is because we know that there will be economic consequences, particularly for small businesses, including job losses, and we know there will be an increase in the illicit alcohol trade, neither of which are desirable. However, if the only way to deal with the current crisis is to have a complete ban, then of course that must happen. But if that can be avoided, then we would recommend that. And we are saying this as civil society. We're not saying this as the industry.
All right.
We are saying this as civil society because while our big concern is the harmful use of alcohol, we also are very, very aware of the extraordinary damage that is being done to particularly small businesses.
All
and
right.
I have 2 children, by the way, who are in the hospitality sector, and I've seen the impact. I mean, they're not in a bad situation themselves, but we have seen the impact that has had. And I do think that we need to take that into account. But at the end of the day, if a complete ban is the solution, that's the route we have to go and bite the bullet.
Fantastic. All right. Final thoughts to you, Martin Kingston, as we basically shut down this conversation. The oxygen availability, Business for South Africa, which you chair, is working hand in glove with government. How has this been allowed to happen that we have a shortage of oxygen?
Well, I think that we need to make sure that we're having the right conversation about ensuring that we can reallocate supply wherever it's required with demand. And that's exactly what happened during the first and the second waves. We need to re-examine whether or not there are further providers of oxygen we can, as I said, reorientate it away from industrial use to ensure that it goes to hospitals and indeed to people's homes. But I just want to stress three aspects. The first is this is not a wave, this is a tsunami. In tsunamis, you find higher ground. We need to do that. The second is we need to prevent transmission wherever we can prevent transmission. I think there's common agreement on that. And the third is that to the extent that we need to provide economic support and relief to those, whether they are individuals or businesses, that are suffering as a result of the consequences of lockdown, then as business, government, and our other social partners from civil society and organized labor, we need to make sure that we can redirect that financial support.
Mr. Mphahlele, let's quickly get your thoughts in less than a minute. How concerned should we be at the actions of political parties like those of Ace Magashule supporters and those of the EFF?
Totally, no doubt that we need to really play active and responsible citizenship. We need this from each one of us, regardless of whether we belong to political parties or not. So it's not about what the government is going to announce tonight. It's about the part that we can play. So active and responsible citizenship is really at the core of controlling the pandemic. And we have seen that actually in India, if we can use that example, the spread was just exacerbated by social gatherings, which were not necessary. So there's no doubt that that will be the driver and continue to be the driver of spreading the cases in South Africa. And hopefully, the president will listen this time and make sure that all social gatherings are banned.
All right, to all of my guests, unfortunately, those that I have not been able to come to, it's because of time, not that I have anything against you. Thank you very much, though, for your participation in this important debate.